Well, we're here again with Dr. Stevens from Kansas, Manhattan, Kansas, the small apple, as you call it. Hi, Dr. Stevens.
Hello, how are you?
Good. Dr. Stevens, I want to talk to you about periodontal disease, gum disease, gingivitis, kind of like all more or less the same thing anyway. Now, it's an infection in the mouth. Here's what I found. Every dentist keeps saying that if you don't fix your gum disease, you will eventually, a year, 2, 5, whatever, lose your teeth. And that's the emphasis dentists put on. And while this is very important, I'm sure, losing your teeth couldn't possibly be a good thing for many reasons, never mind that you probably smell like hell while this is going on in your mouth. Bad breath, and it isn't the garlic breath. I mean, that is still standable. Everybody knows that. Oh, you had a garlic dinner, an Italian dinner, fine. But, that other one is ugly. So the point is, it must cost a lots of money to fix them, and it just couldn't be a good thing. I got that. However, the way I see it is you have an infection in your mouth. That ugly yellow reddish pus, which is, that wah, is in your mouth. And there it is, all over the gums. And when you chew a steak, a potato, it mixes it up, goes into your stomach, and of course it also drips into your blood vessels because the mouth, the gums, the cheeks, they are the blood, they are the gateway to the blood vessels. And thus, you ruin kidneys. That couldn't be good. You ruin liver. That's not a good thing. It's bad for diabetes. Your whole immune system crashes because the body needs to fight this infection all over the place. It is apparently proven that babies have premature babies and thus underweight babies. And all that stuff to me looks much more irreversible, much more damaging than losing your teeth, which at least you dentists have a wonderful way with implants to fix it if it really comes to that. So you still look beautiful after it's all done and all that. But after you have your nice teeth back in, your kidney, your liver, and your diabetes and your immune system and all that still is ruined. And it didn't come back only because you put in an implant. Tell us how far off I am with this statement. How true is it? How not true is it? And shed some light on it of the way you see it.
You're absolutely true. If you have an infection in your mouth with gum disease, it's going to affect your entire body. If you're swallowing and getting pus into your body, an infection, bacteria, your body and all the systems, your kidney, your liver, your circulatory system, your heart, they're all fighting that nasty pus that's getting into your body.
Right. So basically you do ruin those organs in the body.
There's no question. Those organs help try to fight all the organisms that are put in there from gum disease. And that works them very hard, and they can be damaged from doing that.
Right. For instance, we know, or at least it has become lately proven that high cholesterol in itself isn't necessarily such a bad thing. It's if the body, the blood has infections in it, that the high cholesterol becomes gluey and sticky, the C-reactive plus or whatever they call it and all that stuff. And so any infection in the body will contribute to that. So you have an infection which gets on top of it nicely circulated, because it's at the gateway of the blood vessels. It just couldn't be good. All the soldiers have to fight the immune system, and that's like having 5 wars and then engaging in a 6th one. That couldn't necessarily be good, right?
No, it can't be good. The problem with gum disease is you don't necessarily know you have it, but if you brush your teeth and you spit in the sink and you have blood there, you probably have some type of gum disease or different stages of gum disease. If your significant other complains about your bad breath all the time, you may have gum disease. That can threaten your entire body, not just your teeth and your mouth.
Right. So if you have a lowered immune system, obviously the next flu season doesn't have to be the swine flu or the bird flu season, just the next flu season, which is for sure to come 2 to 3 times a year these days. you have a higher chance of getting sick and tired and exhausted and all that. Yes or no?
Absolutely, yes. If your immune system and your body systems to fight infection are overwhelmed or working hard to fight the gum disease and the nasty things from your mouth that are getting into your body, they are going to be overworked and not have enough energy or potency to fight the very next virus or the very next flu that comes through.
I've talked to a bunch of surgeons, and by surgeons I mean people who take out your appendix, your tonsils, or do a hip operation, that type of stuff, right? And apparently lately, only the last couple, 2-3 years, most of them, before they go into any such surgery, start demanding a good oral health, meaning they don't care about a tooth missing as such. That's not what they call oral health. But they want no gum disease, because they say if you have a gum disease, my surgery could go wrong for several reasons. The blood is infected, so my surgery, my wound, which I cut, will get infected, and your body is predispositioned for weakness. It's already weak, and the body can only be so weak for it to be able to experience my cutting in. Have you noticed this trend yourself?
Oh, absolutely. I have patients that are referred from physicians to make sure their mouths are thoroughly clean in absence of decay, gum disease, any other disease of the mouth, to make sure before they have a transplant or before they have some significant surgery, because that can complicate and even risk their lives and certainly the success of the operation, because they're fighting infection from their mouth already. They can't have infection in their bloodstream when they're undergoing those significant life-threatening procedures.
It's interesting that those surgeons only lately have, start paying lots of attention to it. And start looking into the mouth because before they didn't look. Because again, nobody, when you ask the patients and do a verbal history, the guy goes, no, I'm fine, I'm healthy. Yeah, he is, so he thinks, because he doesn't look at gum disease as being an unhealthy thing, and yet it's one of the most severe infections you can have in the body. Well, all right, and if surgeons say that, then you can count that there's some truth to it. It's good that surgeons start looking at that and communicating it, and I guess people really should fix their teeth. It's not only about, not smelling. It's not about having to spend lots of money for implants or dentures, which are then uncomfortable. It's about keeping the body healthy. There's probably lots of people out there who don't know why they are chronically ill, fatigue, kind of like just not up to par, when really the gum disease contributes a lot to it.
Absolutely, and the best thing to do is prevent and keep from getting the gum disease. So if you need to fight an infection or a flu coming around, or you need a medical procedure, you don't have to worry about the complications that gum disease can create to the outcome.
Right. And it just, we only have it in a minute here. It can be treated. We're going to go and you have mentioned already, about treatment and how treatment really has changed over the last 15 some years in terms of gum disease. But can it be handled? Maybe with some maintaining, but can the disease disappear with surgery, laser treatment, whatever these days is around, gum disease laser treatment?
There are a lot of treatments available for gum disease, many new modern ones in antibiotics and antibiotic chips in specific areas. The biggest part of it is get the treatment and then maintain the health of your gums so that it doesn't recur. Just like any other recurring problem, you want to maintain and keep everything healthy.
Right. It's quite amazing how most of us forget that there's nothing in life we do, very few things in life we do which don't need to be maintained. Like at Thanksgiving, we eat we eat a lot. And That doesn't mean next day we don't eat, right? I mean, we still need to eat next day. And, it's maintaining your health, be it in the sporty area, be it in the healthy vitamin food, maintaining a business. Every day we need to fight to be there and need to keep doing things. And that's why I guess they say the people who are persistent and, have a big-headed determination, which stands for PhD, the type of title you guys have, or PhD stands for big-headed determination. No wonder that those people in the end succeed the most, because they know that exercising, brushing teeth, doing whatever it is, isn't a one-time thing. Dr. Stevens, thank you very much for shedding light on that. I think this is one of the most important health factors out there, not just in the oral health, but period. I think it affects so many things, and is it true that more and more people, that gum disease is on the rise? It used to be in the 60s, 70s, cavities was like destroying life, and that is an infection too, by the way. But now it is gum disease, which is kind of like just literally lots of people have it. Yes or no?
It is. It's very prevalent now. Most patients that we see new have some stage of gum disease. Well, hopefully, very, very early stages that are quickly reversible.
Mm-hmm. Beautiful. Thank you very much, Dr. Stevens.
Thank you.